Okay, great. Welcome to the Arts and Health Incubator Grant Overview and Application Walkthrough for the April 2026 deadline. The agenda will be, I'll be introducing the program. I'll go over the program goals, eligibility, funding rules and restrictions, starting your application, the evaluation criteria and definitions. We'll walk through the application and there'll be time for questions, and I'll share other ways you can get help during this grant period. So this program, again, is brand new. This program was funded by, it will be funded by discretionary state funds. This is the first time we've actually gotten additional funds above our grant line to offer a small grant program that seeds arts and health pilot programs and thinks about arts and health in new ways. So this is funded by state discretionary funds and not federal funds, which is why this will be open to artists and organizations. So the award amount that you can request is up to $7,000 if you're an organization and up to $5,000 for individuals. And who can apply for this grant is artists who live in Rhode Island, 501c3 nonprofit organizations based in Rhode Island, 501c3 nonprofit organizations currently receiving general operating support for organization grants. Normally, if you get general operating support from RISCA, you cannot apply to any other grant because all of what you're doing falls under general operating support. There's a bit of a distinction this time, and the opportunity to apply for general operating support for this coming fiscal year is not open until the fall. So we're allowing general operating support organizations to apply at this grant deadline for the arts and health grants, and they will have to pick which one they would want to apply to if they apply at all. And with this grant, groups that are fiscally sponsored by a 501c3 nonprofit organization based in Rhode Island can apply. So this grant, as I said, is new. We're really excited because it's a little different than our other arts and health grant or other grants we've offered. It's going to fund organizations or artists for projects that address one or more of the following goals that are embedded in the health priorities of the state Rhode Island Health Plan. This will be physical health and well-being, behavioral health, older adults and caregiving, healthcare system strengthening, and equity for underserved communities. And just to give a little context, when we talk about physical health and well-being, that could be arts engagement that improves cognitive, emotional, and physical health, that offers preventative and non-clinical wellness pathways. In behavioral health, this could be creative approaches that address loneliness, anxiety, and depression, and supports resilience and mental wellness. In seniors and caregiving, arts as tools for dignity, purpose, and social connection could support the Office of Healthy Aging's core populations. Healthcare system and strengthening integrates arts as an innovative, sustainable supplement to traditional services, aligning with systems modernizing goals. For equity for underserved communities, the arts could include creative aging priorities for BIPOC, LGBTQ, and rural and disabled older adults, which mirrors the equity commitments in the Rhode Island 2030 plan. And in the guidelines, I'll go into more detail. There's links to the state website with more information. Funds from this grant may be used for the following projects. And when we define projects, it's different than our other grants. This could be for planning, capacity building, professional development, pilot projects, evaluations, and coalition building. And again, we're excited about this. That's different than our other grants because we're trying to think of ways where arts and health intersect and think of innovative ways of how we can use this. And so oftentimes in our other project grants, we're funding a project that has an intent around bringing arts into a space, and there's a beginning and end to the project. This is the opportunity to fund ideas, bringing people together, really like outside the box opportunities that we're not able to always fund through our other project grants because of the constraints of federal funding from the NEA and the cost match. And so, because of this being funded by state discretionary funds, it allows us to be a little more innovative. Also, for the ones that get granted in this cycle, the grantees and the artists will participate in an arts and health peer learning cohort. So the grant program goals are innovative ideas that use the arts to address, as I said, one of the Rhode Island 2030 health priorities, a stronger recognition of the arts as essential to health and well-being, an increased understanding of the role of the arts in supporting health outcomes, an expanded recognition of the arts as integral component of health and well-being strategies, and building a deeper network and stronger connections between arts and health. So the timeline for this grant, the grants are open as of yesterday. The application virtual support office hours like today will be happening through February and March. The deadline for the grant is April 1st at 11:59 p.m. And the funding period for this grant will be July 1 through June 30th of 2027, and that mirrors the state's fiscal year. Grant notifications will be sent in mid-June. That's always tentative because it depends on the approved governor's budget for the new fiscal year. And because there's a peer learning cohort, there's going to be a kickoff meeting, which is anticipated in September. And this is going to be a peer learning cohort that will include grantees from the Arts and Health Grant and the artists that are participating in either of the grants. The grant cohort will meet 2 to 3 times during the project period, and there'll be a final report, as with all our grants, due on July 31st at the end of the project period. So the eligibility for this grant is direct participation of artists as a core element of this project. It must address at least one of the 2030 health priorities, but you don't need to address all of them. There's not points for doing more than one, but just at least one. A health professional or subject matter expert is an advisor on the project, and that there's a agreement that you'll participate in the peer learning cohort. So the 5 different buckets that I mentioned before that this can fund is planning, which we define as a structured process for clarifying goals, identifying partners, defining scope, designing activities that might align with arts practices with health, community, or public outcomes. And so in this work, the planning emphasizes the design, working across sectors with arts and health, and readiness for possibly implementing something rather than just not just about the conception of an idea, but really thinking about what what this could be for with an intent that you would carry that out. The funding might only be applied to the planning process, but the idea is that it's a feasible plan that could be implemented if more funds were available. The next is capacity building. So activities that strengthen an organization or a community's ability to integrate, sustain, or scale an arts-based approach with health, public health, or social priorities. So this could include developing skills, fostering partnerships, building infrastructure, or a shared understanding that's necessary to support arts integrated work over time. So again, this grant allows the ability to take the time to build infrastructure and think about planning that some of the other grants don't always allow for. This could also be for professional development, learning experiences that support artists, health professionals, and community partners in building the knowledge, skills, and shared language needed to work effectively at the intersection of arts, health, and community well-being. So this could include opportunities that deepen the practice, encouraging collaboration, and supporting ethical, responsive engagement. Pilot projects. These could be a time-limited exploratory initiative designed to test new ideas, partnerships or approaches to integrating the arts into healthy or community contexts. Again, the pilot projects emphasizing learning, adaptation, and feasibility. Again, really thinking innovatively in how arts and health can intersect. The next project could be evaluations. So, developing structured processes for examining and understanding outcomes and experience and impacts of arts integrated work. This could be reflecting on projects that have been done in the past or thinking about going forward, about doing deeper evaluations and what that could look like. So, in this context, evaluation may include the qualitative and quantitative methods used primarily for learning, accountability, and improvement rather than just judgment and clinical validation. And we know that artists, when you bring artists to the table, they can think and evaluate things in new ways because of the multiple tools that they can have with different art forms and ways of thinking. The other piece could be coalition building, which would be the intentional formation and strengthening of relationships among organizations, practitioners, and community stakeholders working across sectors. Coalition building in this work would focus on a shared purpose, trust, coordinated action to advance arts integrated approaches to health and community well-being. And so again, with any of these pieces that you pick or areas that you would focus on in this grant is really thinking about the mutual trust and relationship between arts and health. So eligibility for this grant. So if you are an artist applying, this would be the artist would have to be, the individual has to be 18 years of age or older, have lived in Rhode Island for at least 1 year at the time of the application. Rhode Island would be your primary residence, and it's this address that you use on your legal forms. You have to be a legal resident of the United States with a tax ID number. That could be a social security number or an individual tax identification number. Um, and to be eligible, you have to, you would be ineligible if you are a staff member of RISCA, you are on the council at the state council, or you're an immediate family member of a staff or council member. You would be ineligible if you are currently enrolled in an arts degree, seeking program or attending high school full time. You cannot be the primary artistic force. You are not the primary artistic force behind the project. Um, you would be ineligible if you're already applying for support for this project or aspects of this project through another RISCA grant program. And as with all our grants, you cannot be delinquent on any final reports from any previous grants. For organizations, eligibility would be you must be a nonprofit organization. You must be conducting business incorporated in the state of Rhode Island as a 501c3 tax exempt status with the IRS. You're registered with the Rhode Island Secretary of State. You're governed by a revolving board of directors, trustees, or advisory board. And if you're not a 501c3 tax exempt, you are a Rhode Island based organization using a fiscal sponsor that uses the above requirements. And if you're out of state organization, you still must be registered with the Rhode Island Secretary of State and principal businesses in Rhode Island. And if you have questions about any of that eligibility, you can always ask me and talk to me about that. As well as if you're a fiscal sponsor, I'm not going to go into all the details because this usually just applies for a small group of organizations. You can reach out to me. Okay, and then further eligibility, if for organizations, the organization has to have a unique UEI, which is free from sam.gov. The project activity must take place in Rhode Island, and the program occurs in spaces that are ADA compliant. And then we have a link for what that means. This organization also cannot be requesting support for this project or aspects of this project through another RISCA grants program. You can't be receiving direct funding from another RISCA grant for this. And again, not delinquent on any final reports. So funding rules and restrictions. All grants are contingent on the availability of funds from the Rhode Island General Assembly and the NEA. That's just in general for our whole budget. So we'll find that out in the spring when the budget gets passed. The maximum grant award in this category is $7,000 for organizations and $5,000 for individuals, but partial awards are common, and partial awards will be no less than 50% of the application request or $1,000, whichever is higher. And grant applications are considered on a competitive basis. The award amount may vary from cycle to cycle depending on the available funds, the number of applications, and the panel's decision making. If you receive a partial award, um, you may modify the project. You can reach out to myself or other RISCA staff to discuss the modifications. If you receive partial award and you decide to go ahead with the project, you still must participate in the peer learning cohort because that's one of the requirements of this grant. But you always have the option to decline a grant award, whether you get full funding or partial funding. We understand circumstances might change, and there is no negative impact if you decline a grant award at all. We totally understand circumstances might change and you might need to do it for whatever reason. You also, if you receive a grant, you must credit the agency on the marketing materials, and we have all that information on our website. There's a number of non-allowable expenses. I won't go through all of them. They're also listed in the guidelines, just specifics. And again, if anybody had any questions about that, I'm happy to walk through that. So the panel that will be reviewing these grants, we will have 3 to 5 individuals on the panel. RISCA staff are not the panelists. We do not make the funding decisions. There will be individuals who work in the arts and or health sector. There will be at least one professional artist on the panel. And there will be individuals who work at state or local arts agencies at or similar vantage point in the arts and cultural ecosystem. So again, the panel is going to be made up of a group of arts and health people working in those fields. There won't be just artists on that or just organizations or just arts and cultural organizations. Definitely a mix. Panel reviewers will use evaluation criteria to evaluate and recommend application for funding, and I will go through that. So the evaluation criteria that the panel will be using will be looking at the logistics, artistic vibrancy and impact, and the arts and health component. Under logistics, the application clearly states what will be done by whom, when and where things will take place, and how this project will happen both logistically and financially. And the applicant indicates relevant metrics to measure their progress. For artistic vibrancy and impact, the panel will look at, is the art central to the project? Do the artists provide a positive and purposeful experience for the participants? And does this project provide access for or engages underserved communities as identified by the NEA? And in the arts and health piece, the panel will be looking at, does the project utilize the arts to address one or more of the following goals embedded in the 2030 plan's health projects, which is what I mentioned before, which is physical health and well-being, behavioral health, seniors and caregiving, healthcare system and strengthening, or equity for underserved communities. And again, there won't be any penalties if you're only addressing one. We don't expect, again, that you need to look at all of them. And the panel will not be negatively judging if you're focused on one. The other piece that they'll be looking at is the health and or relevant community partner and artist integral to the design and implementation of the project. This is a partnership and shouldn't just be artists. Even if the artist is the applicant, they should be thinking about what they're going to do in partnership with a health or public health professional and thinking about how it can have an impact because nothing exists in a vacuum. There's also a clear plan to define and measure success. So once you have an understanding of the guidelines and have reviewed this evaluation criteria, you can start your application. So you need to start gathering your materials. So if you're an organization, you would need to gather your 501c3 determination letter, have your UEI. If you don't have a UEI yet, and you can still apply, but you will have to you can talk to me. There's a code that we'll put in to be a placeholder. Before the application is submitted and goes to panel, you will have to have your UEI in place before that time. You would also need recent 990s from one of your past 3 fiscal years. And if you're using a fiscal sponsor, you need your fiscal sponsor's determination letter, their UEI, and their recent 990. Also, support materials for the panel review would be your project budget, using the risk organization budget template, a project plan, also on the project risk project plan template, a bio resume of the artist involved, a bio resume of the health advisor or subject matter expert, artistic work samples, which would be up to 3 samples showing how the artists involved in the project have experience relevant to this project, and they're uploaded to a Google Drive. And for this, for the artist, and it's not just about the artist background in their art form, it's their work in arts as related to that would be relevant to working in arts and health. Also, a work sample list and a testimonial from a person or people who have experience with this program, organization, or the artists. And now for the application. As I go through this, you'll see that it directly relates to the panel review criteria and that the questions that you'll be asked on the application are intended to be very focused, and that when the panel is reviewing it, they're reviewing the questions and just focused on that. And I know sometimes there can be lots of other information that is really nice to share, but we want to try to make this simpler for the applicants and for the panel to be focused that it's all relevant information and what's being reviewed. So the first section of the application is going to have information for the staff to judge eligibility. So before it even gets to panel, there's going to be information for the staff to look at. The 990s, the fiscal sponsor letter, do you have a UEI, and things like that. We'll review that before it goes on to the panel. So section 2, which is the information that the panel will see, will only be the logistics, artistic vibrancy, and program-specific questions. And this is the opportunity for the panel to review those sections and score them. So the logistics part of the application is designed to be simple: check boxes, uploading the budget, project timeline, simple questions like how much are you asking for, names of who's involved in the project for the panel to get a sense of, literally the names of the artist, the project coordinator, are there other partners involved, where will it take place, who is it intended for, and there's a series of check boxes for the participants, and then places for uploads. For the metrics of success section, you'll select all that apply. What are the goals of this project? What will you be measuring? Which could be the number of participants, the change in the way participants, attendees think or perceive things, satisfaction, artistic growth by the creators, and other. Since this project or this grant is funding all different things from a planning process to an actual pilot project, there is room that you would define what it is, the goals of this project, and we can't presume what that would be. So there'll be a section on artistic vibrancy and impact. So the question, and these will be answered a maximum of 1,000 characters each, not 1,000 words, but 1,000 characters. We're trying to keep it simple for the applicant and for the panel. So they review a lot of applications, and we want the applicant to try to be succinct to just get at the essence of what and to just answer the question directly. So the first is just tell us how art is central to this project. Two, how will the artists provide a positive and purposeful experience for the participants? And again, because this could be for planning or project, participants will be defined by you, who you're working with. And then how does this project provide access or engage underserved communities as identified by the NEA? And the arts and health section will have three narrative questions, again, maximum of 1,000 characters each, and include space for the testimonial upload. So here you'll describe how the project utilizes the arts to address one or more of the following goals and the priorities, as I mentioned, and then describe how the relevant health or community partners and artists are involved in the design and implementation of this project. And then last, describe your plan to define and measure success. And again, because all these projects will be very different, it'll be up to the applicant to tell the panel what that would look like, what it is, and then what measures of success would look like. There'll be space to upload the bio and resume, upload for the testimonial. I'm going to, let's see. I'm going to pause this for a second. I'm going to stop sharing. We're not at questions yet. I'm going to walk through the application. I think let me just stop sharing this for just a second. Bear with me. Okay, I just wanted to show you on the website, the arts and health guidelines are all listed on the website. If you go, and I'm going to share links at the end. And on the website it has full description of the guidelines in much more detail than I just talked about. And on the far right-hand side, you can print the guidelines. You can print a list of the application questions. You'll find all the templates and fiscal sponsor letter and then the link for applying for this grant. And if any of you are applying to or thinking about applying to either Arts and Health Grant, there's two different portals. So this one, I'm going to just show you, you can click on it. It will take you to the traditional, the place where people are very familiar with applying. The new Arts and Health Grant that I talked about this morning has a whole new portal that's from the state system. So just to let you know that we do have two different portals depending on which arts and health grant you're applying to. So I'm just going to show you what this would look like when you go into this. So this will take you to Foundant, which is our risk of grants portal. If you don't see a grant right here, because I'm proxying as an applicant, but I also have the role as a panelist. So I'm going to click on applicant, and then it'll switch the screen, and I will see that. Let's see. If I want to apply, I will see this screen that shows what's available. So it'll show there's an Arts and Health Incubator grant. There's also a Big Yellow School Bus grant. All our other organization grants this year, project grants for organization, arts and health, and project grants for education, all now you'll have to apply for on the state grant system. So you will not see them here in the system at all. So you would click on apply, and then it will take you to the application. It will have all the questions here listed, what I talked about in the PowerPoint. There will be spaces to answer all those questions. And if you have any questions about that, I'll have drop-in office hours. So I'm going to stop sharing. And I'm going to stop the recording and we're going to have time for questions. So let me just